Equity is being left behind when it comes to vaccine distribution in North Carolina. For example, Black communities, the hardest hit by the pandemic, are getting fewer vaccine shots than those in white communities. Our Bill O'Neill dives deeper into the vaccine inequities in the Piedmont Triad.
New data shows that North Carolina's vaccine program is anything but equitable. African American communities, among the hardest hit by the pandemic, lag far behind white communities when it comes to getting their shot. The numbers just released by the health department tell a story of vaccine inequity. 14% of those who have received their first shot are Black. 78% of those vaccinated are white. Alfonso Vance, who received his first shot last weekend at Galilee Baptist Church in Winston-Salem, offers up one reason why the Black community is underrepresented.
Black people don't have a lot of opportunities, a lot of transportation to get from place to place to get these vaccinations. So I think that has a lot to do with it.
Forsyth County's vaccination numbers are similar to the state's. 14% of those vaccinated in the county are Black, 66% are white. The numbers are very similar across the triad. In Guilford County, 18% of the vaccines were given to the Black community, 75% to the white community. And in Alamance County, 16% of the vaccines went to members of the Black community, 78% to the white community. The data on who's getting vaccinated is clear, but not the reasons behind the inequity. The pastor of Winston-Salem's Galilee Baptist Church, which hosted a vaccine event last weekend, says one of the factors is fear.
We've been talking about it and educating our congregation about the vaccination, the process, the impact that it will have on the community.
Fear, transportation, misinformation, all potential reasons for North Carolina's vaccine inequity. Church leaders, however, have played a lead role in getting members of their congregations vaccinated.
I'd just like to encourage those who are still apprehensive about it to take the opportunity to do their own research and to make the decision to help us to stop the spread and start the healing.
Governor Cooper offers up two more possible reasons for the inequity. He says the long-standing inequity in the healthcare system and the healthcare coverage gap. In Greensboro, I'm Bill O'Neill, WXII 12 News.